Today I will talk about tooth extraction. First, there will be a question like, what is tooth extraction? I think tooth extraction is a dental procedure that pulls out human teeth. Tooth extraction is cheaper than other dental procedures and is covered by the National Health Insurance. Most people have their teeth pulled out when it's time to lose yuchi out. Uh, and next, I will talk about when you have to do tooth extraction. First, I think when we have severe toothache, we have to do extraction. Second, uh, when we have a tooth nerve necrosis. In case of a tooth that is unable to be treated with nerve treatment, or failure of nerve treatment, or the pain is not relieved after nerve treatment, I think we have to do tooth extraction. Third, if you have a gum disease or you have punchi, your teeth may shake a lot due to a loss of gum bones. In this case, I think we have to do tooth extraction. Fourth, in order to secure a space for correction in orthodontic treatment, we have to do tooth extraction. Fifth, teeth that deviate from normal teeth cause damage to surrounding soft tissue and cannot be treated with braces. In this case, we have to do tooth extraction. Sixth, when we have a cracked or broken teeth or roots, we have to do tooth extraction. And seventh, for design and safety of teeth with perturbations for the production of partal dentures. Eighth, in case of exact teeth prevent permanent teeth from coming out and are likely to cause absorption and displacement of the dental muscles. Ninth, in case of rare bones or in pathological condition due to osteomyelitis, jawbone tumor, and gum bone necrosis. And last, in case of to treat oral cancer, if your teeth are in the wind or have severe dental atotasis prior to the onset of radiation therapy, we have to do tooth extraction. How long does it take to pull our teeth out? I think usually it takes 10 to 15 minutes or less, except wisdom tooths. So I thought about questions about wisdom tooths. Let's find out about it. First question will be like, do I have to pull out my wisdom tooth? You don't have to pull out your wisdom tooth if it is out normally. Your jawbone is full developed and you can chew on food. However, the molars in front of them are more important than wisdom teeth. So if you think there is any chance of a bad effect on them, you should pull them out. Insufficient development of the jawbone leads to a lack of room for wisdom teeth to come out, so wisdom teeth are not properly produced and crooked or buried in bones and gums. In this case, wisdom teeth cause various problems. In second question will be like, how long does it take to get out a wisdom tooth out? I talked about it beforehand 3 minutes, but I will talk about it more. Wisdom tooth extraction is divided into pulling out if the tooth is straight out and sticking out if it is buried or tilted in the gums or bones. If it is straight out, the gums are cut off with a surgical knife after local anesthesia, bone removal, and tooth cutting. If the tooth is buried or tilted on the gums or bones, the gums will be dissected with a surgical knife after local anesthesia, and bone deletion and tooth amputation will be performed. Wisdom tooth extraction takes about 50 minutes to an hour on average, depending on the level of difficulty. And it usually takes more time in case of unexpected problems such as bending roots or calcification of bones. The next question is, how do you anesthetize your wisdom tooth and does it hurt? Wisdom tooth extraction uses a method of local anesthesia of large nerve bundles, and it is commonly called transmembrane anesthesia. In addition, the injection method is also used near the teeth called salivary anesthesia. In most cases, it is almost painless without inflammation. If there is an inflammation, the acidity of the inflammation prevents anesthesia from being normal. Usually, anesthesia is done using 1 or 2 anesthetic injections ampoules, and it is called lidocaine. And if pain occurs over time, you use 1 or 2 again. The next question is, what are the after effects or complications of wisdom tooth decay? Wisdom tooth extraction is an oral surgery. Of course, there may be complications and after effects from surgery. The most common problems are postoperative edema and pain. Most of the time, the surgical area can be swollen and painful for about a week on average. Post-operative infection is also an occasional problem despite the effort to prevent infection as much as possible. To prevent this, if you are not feeling well, you should talk to your doctor and postpone your extraction. Follow the precautions after your extraction and take a rest without overdoing it as much as possible. Also, sometimes the bleeding does not stop or the hemostasis does not stop well. In the case of mandibular wisdom teeth, there is often a passage through the mandibular nerve tube below the root, but the root of the mandibular nerve tube may span and cause damage at the onset, which may lead to sensory abnormalities and sensory loss. It usually recovers over days to weeks, but in severe cases, it may take a year or 2 to return. And I will talk about the last 2 questions. What are the things I have to do after tooth extraction? First, you have to take the prescribed medication as directed. Then the gauze passed to the spot where you left it, bites for 2 hours, and swallow saliva or blood in your mouth. Second, apply the ice pack every 8 hours or more, and do not brush your teeth, but gargle for 30 seconds to 1 minute with disinfectant or gargling. Third, you should eat soft food or lukewarm drinks and get plenty of rest. The last question is, what things should I avoid after I get my teeth removed? First, do not touch the foot area because there is a risk of infection if you touch it with your tongue. Likewise, you shouldn't eat too much raw food to irritate your spot. Second, you should refrain from using straws that can cause pressure bleeding when inhaled. Third, you need to quit smoking and stop drinking without going to a sauna or excessive exercise. Uh, my presentation is all, and I will stop talking about tooth extraction. Thank you for listening to my presentation.